Hello, my name is Esther Park. First of all, I'd like to thank you for giving me the opportunity to share my business plan. No matter what the healthcare system evolves into, there will always be a need for free clinics. Why will that be? There is a significant portion of the population that needs it. A staggering 40 million Americans live today without health insurance. The number of uninsured people has been increasing since 2008, and these are some of the sickest people in our country. Yet many do not know of their condition until the disease symptoms show up late in the course of disease. The lack of access to care and the later stage of disease at the time of diagnosis are significant problems that affect how our healthcare dollars are used. Overall, the uninsured population has a 20% higher risk of living with obesity than the general population. Obese adults and children frequently suffer from secondary health conditions such as diabetes and hypertension. Many uninsured people forego medication therapy due to the high cost of medications. All in all, the uninsured patients with chronic diseases have a 40 to 50% higher likelihood of premature death. These situations can drain our community's medical resources to the degree that it can affect how everyone receives care. Providing free clinics for the uninsured will result in overall healthcare cost savings that will ensure that the healthcare resources will be available for everyone who needs it. Lifestyle Community Clinics, or LCC, is a nonprofit local free medical clinic. The values LCC brings to the community are many. LCC aims to decrease the prevalence of chronic diseases in the uninsured population by 2% per year by providing regular checkups and seminars that deal with prevention of diseases. In addition, LCC will aim to reduce overall cancer mortality by 50% through aggressive cancer screening using tools such as pap smears and mammograms. LCC also aims to reduce mortality in uninsured diabetics by 40% through early screening and intervention. Smoking cessation classes will also be an additional value for the 30% of the uninsured population who currently smoke. Lastly, LCC has a goal to reduce heart attacks in the uninsured by 25% through prevention and education. LCC is the solution to the healthcare problem because it will strive to prevent disease or further progression of disease through aggressive screening and education. By focusing on prevention of disease, LCC will lower the cost of care for everyone. For example, approximately 30% of ambulance bills, which usually range from $500 to $2,000, are not paid. When people don't have insurance, most do not pay for the ambulance rides. Cost shifting occurs, where those who are able to pay end up paying more to make up for those who can't pay. The fire department in New York City had to write off $120 million in 2011, of which most of the cost was subsidized by the taxpayers. Likewise, approximately 20% of the emergency room users do not have health care insurance. Most of the cost to provide care for the uninsured patient is written off as bad debt by the hospitals. If LCC were to reduce the number of patients who visit the ED by 20%, as indicated by the initial free clinic directors' questionnaires, there would be a correlative reduction also in the use of ambulance services. Combined, this would amount to a tremendous savings for the healthcare system that would not have to be subsidized by those who are able to pay. The resulting value of the savings in healthcare costs to everyone would be immeasurable to all of us. So how do we start a business like Lifestyle Community Clinics? First, we need to have a physical location from which the patients can be seen. The clinic is located in Lakewood, Washington, an ideal city to establish a free clinic due to its higher than national average of uninsured people. A 3-room office suite in the heart of the city is easily accessible. The clinic will also be used as a meeting room for group seminars and workshops. LCC has an initial capital of $10,000 from various private donors to launch this program. It has also acquired many used medical equipment from other private medical offices, but the disposable medical supplies that will be discarded after each patient visit are an expense that must be met through monthly income. The in-kind donations by the providers, nurses, and other professionals through time given to the clinic converted to dollar amounts accounts for a majority of the clinic needs. Therefore, an additional $2,000 per month is needed to pay for rent, utilities, and employed staff, and purchase of non-reusable supplies. Ideally, an endowment in excess of $2 million would be sufficient to generate a residual interest income each month. This would be donated by private, public, and religious organizations that support free clinic operations. The The largest expense in a typical medical clinic is to provide monetary compensation to providers, nurses, clerical office staff, and administrative support team. The generous in-kind donations of the providers and nurses dramatically reduces the amount needed for human resources. The paid staff include the front office clerical staff, office manager, and bookkeeper. Health educators who run the group seminars will be given a small token of appreciation for their services. A limited number of laboratory testing and x-rays are provided by the local hospital laboratory and imaging services at no charge to the patient. Generic medications are also purchased from the local hospital pharmacies and provided for a nominal fee. A free, secured, cloud-based electronic medical record system called Practice Fusion will be used to document each patient visit. LCC plans to market its services using the local newspaper, the radio, and the internet. LCC has created a blog-type website. Additional specific marketing will target the ethnic minority groups through their newspapers and posting flyers at the local cultural center. Additional flyers can be posted at the community center and library without significant cost. Market research indicates that most free clinics are known through word of mouth. Patients will be encouraged to bring their families and friends who need medical care to LCC. There is a cost to start up marketing, but based on the capacity of use in the existing free clinics, I don't anticipate any problems filling up the patient slots at LCC. Free clinics typically meet capacity around 1 month of operation. The main competitor for LCC is a primary clinic that functions based on a fitness club type monthly membership fee. Patients pay a monthly premium based on their health status, with healthier individuals paying a lower premium and sicker individuals paying a higher premium. Services are limited to primary care services with a limited number of labs and x-rays. The local free clinics also offer similar services. On the other hand, LCC offers both primary and specialty care such as ophthalmology, physical medicine and rehabilitation, and obstetrics and gynecology. The availability of specialties depend on the volunteer provider specialists. Another competitive advantage is that LCC emphasizes on prevention of disease through group seminars and workshops. An ounce of prevention is worth more than a pound of cure. It is much more cost-effective to prevent disease than to treat disease after its onset. Prevention is an effective way to optimize healthcare resources. Lifestyle Community Clinic's goal to become a sustainable free clinic can be achieved by operating on a lean management system. A maximum of 80 patients can be treated at LCC per month. If every patient paid the basic $20 per clinic visit and $40 for a procedure, the revenue per month would be $1,200 after subtracting the cost of goods. This amount would cover about 10% of the cost for the care provided, which is about $13,000 per month. The provider and nurse in-kind time donation add up to an equivalent of $6,000 per month, and with the additional in-kind donations from attorneys and interpreters, these donations would cover about 60% of the cost of care. This leaves about 30% of the costs that need to be subsidized by donors like you. LCC will also recruit additional professionals who are willing to volunteer their time and expertise to provide quality care for the uninsured. Having a large pool of available providers gives LCC the flexibility to expand clinic hours and days as the needs arise. Medical residents and fellows, as well as students in allied health, can use the LCC clinic to learn under the supervision of a licensed professional. The educational benefits for these professional trainees are invaluable as they will carry the acquired skills with them in their professional careers. In fact, because LCC is located within a short driving distance to a large family practice residency and a rural fellowship program, and because the trainees actively seek to learn under the supervision of specialists, there will not be a shortage of primary care providers. So what does LCC need from you? LCC needs your generous monetary donations to fulfill its mission to offer high-quality care to the uninsured population at an affordable cost. The monthly cash flows and break-even points occur in the second month of operation, assuming that the clinic is at full capacity from the first month of operation. Aggressive marketing prior to opening of the clinic will most likely make this an achievable goal. It also needs your support through your time and donation of special skills you may have that would make it a more efficient organization. It needs you to give generously to meet the 30% of the monthly expenses to keep LCC sustainable. Our goal of $2 million can start with your tax-deductible contributions today of $10,000 or more. What do you get in return? Investing in LCC will give you the opportunity to get a tax-deductible receipt for your donation. The uninsured people will have an opportunity to regain their health. This will improve the health of our community to the level that there will be fewer uninsured people utilizing the ambulances and the emergency rooms. As a result, the healthcare costs for everyone will decrease. As the health of the uninsured people improve and they become more productive in their jobs, they can also become patrons of your businesses. Through the process, our medical trainees will obtain excellent experiential education and acquire skills they will use in their professional careers. Efficient use of healthcare dollars will ensure that there will be enough for each person when the need arises. I invite you today to partner with Lifestyle Community Clinics to make these goals a reality. Thank you so much for your interest in this exciting venture. I will contact you in the very near future.